Hello and welcome. I'm your host, Neil Howard. Thank you so much for returning for another segment of Health Professional Radio. In this segment, we'll be speaking with returning guest Brad McElya. He's joining us here as Walgreens Director of Specialty Health Solutions to talk about how pharmacists are uniquely positioned to provide holistic care to people living with HIV who may also have other health issues. He's also going to talk about managing the needs of an aging population that's living with HIV and the importance of cultural competency among people working with those living with HIV. Welcome back, Brad. How have you been?
And Neil, doing very well. And thanks so much for having us back again to talk about, such an important topic. And just consider it a great honor to be back with you.
Well, for those who may not be familiar with you as a contributor, give us a little bit of insight into your professional background and talk briefly about being Walgreens Director of Specialty Health Solutions.
Yeah, very well. As you mentioned, I am Director of Specialty Health Solutions, really responsible for clinical product and service strategy around a few different areas. HIV treatment and prevention is one of those areas, but I also have other health conditions that I support. I am a pharmacist, been with Walgreens now for going on 22 years, and so quite a bit of my life been spent with a company that love working for Walgreens, loved being able to do what I'm able to do, and then I think most importantly, being able to offer critical clinical products and services to our patients, especially those living with HIV or those that may be at risk of acquiring HIV. So very happy to be back.
World AIDS Day just passed this past December the 1st. Talk about the importance of World AIDS Day.
World AIDS Day for us is a time of reflection. It allows us to think back on all of the advances that have been made around HIV and AIDS. It also gives us an opportunity to think back on the lives that have been lost because of AIDS. In that, it helps us to also think about the future, thinking about additional advances, other ways that we may be able to positively impact patients' lives and to prevent further transmission of HIV. And so for us, I really think about World AIDS Day as a day of reflection, and then also motivating us to be able to do even bigger and better things in the future.
Are pharmacists adequately supporting folks that are living longer with HIV due to those advancements?
I do believe so. I think that we as pharmacists have a critical role, especially because of those advances that I was just talking about. If you think about ways in which now we're able to really impact patients' lives, we can help them to remain adherent to their antiretrovirals, for example. And we know as long as patients are adherent to those medications, then their viral loads can be suppressed, so much so that they're not going to transmit HIV to another individual. And so in that, you see that individuals end up having better health outcomes. But in addition to that, you prevent transmission of HIV. And so you look at a role of a pharmacist and what they can do as patients are aging, especially around HIV, really able to contribute in making sure that you have the better health outcomes and eliminating transmission of HIV. In addition to that, if you think of ways that patients living with HIV are advancing in age, what we're starting to see is additional comorbidities that may pop up. Natural comorbidities such as diabetes, hypertension, high cholesterol, for example. And we're able to help patients with those medications and those conditions as well. And so I like to think of it as really having a critical role in making sure patients are adherent to many different medications, making sure that they have access to important medications, and that's going to help them overall in terms of their patient outcomes with whatever condition it is. And so we like to think of them as really treating individuals, not individual conditions, but as we know with HIV, many of our patients living with HIV are also going to have other comorbidities that we can have an impact on those as well.
Talk about how the training has evolved for pharmacists in view of these advancements and the aging population.
Yeah, training for us is critically important. We take that very seriously, especially at our headquarters, making sure that we're rolling out a timely training to our team members to ensure that we can offer compassionate and confidential HIV care, both HIV treatment as well as prevention. And so we do considerable training around stigma reduction, also thinking about cultural competencies and making sure that our pharmacy team members are equipped to be able to have whatever type of conversation with the patients that we may need to have. So there is a lot that goes into that training to ensure that not only do they understand clinically, but also socially, and just to be able to be equipped to be able to handle those conversations. One of the things that we're looking to do in the near future, where we are partnering with one of our clinical advocacy partners to be able to launch a new e-learning series that will help us to be able to do that in a bigger and better way, in our opinion. And so, again, we take training very seriously. We're able to roll that out across our entire enterprise. Mm-hmm. And for us, we believe that that's critically important in order to make sure that we're having the impact on helping to end the HIV epidemic.
Was that learning endeavor discussed at the U.S. Business Action to End HIV Coalition meeting that took place at the White House? Was that included as well? And can you tell us more about what was included in that meeting?
Yeah, that U.S. Business Action to End HIV Epidemic, that was such an exciting time for us to be able to be there. Really it was in response to the National HIV and AIDS Strategy and what the White House is doing, especially around commemorating World AIDS Day. So we were a part of that conversation. We believe that it is an opportunity to combine the strengths that we have, or the coalition that has, as well as what Walgreens' expertise in HIV treatment and prevention, and really is going to be critical in helping to end the HIV epidemic. To your question, Neil, yes, we did discuss that. It was one of the things we all had an opportunity to speak about, various ways in which we're making an impact to help to end the HIV epidemic. And that was one of the things that we discussed because, again, being able to roll training out across an entire enterprise can really have a significant impact. And so our encouragement is that other companies do the same to ensure that the workforce is properly educated around HIV treatment and prevention, as well as how to delicately handle those conversations with any patient that you may come across.
Is there anything that you'd like to add for our listeners, Brad? And then give us a website where we can learn more.
Neil, I think that we're at a very critical time. You heard me talking a little bit about it, and I think one of the things that highlights with the U.S. Business Action to End HIV, the HIV epidemic, it really highlights the critical time that we're at right now, where I do believe that we're able to end the HIV epidemic. We have tools, we have resources, and probably most importantly, we have the workforce that is ready to make an impact in ending the HIV epidemic. Now it's just a matter of getting the word out, having events like this that you can talk about HIV treatment and prevention, you talk about ways in which you can make an impact. And so we're really excited and hopeful that we can contribute and make an impact on patients' lives. There are more information about Walgreens HIV services. You can find that at walgreens.com/HIV, and would encourage the listeners to visit some of the resources that we have on that site. But again, Neil, thank you so much for your time. Greatly appreciated, and consider it an honor to be here.
Brad, always a pleasure. Looking forward to our next conversation.
Thanks so much, Neil. Take care.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with returning guest Brad McElya. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/healthprofessionalradio.